Hey, Mark Rogers here. Hope everything is well out there in retirement. It's November 14th. Happens to be my dad's birthday. He passed away many years ago, but the 14th of November. And I just wanted to say hi to everybody. It's a crazy Medicare season right now, given the fact that there are substantial changes going on that Congress has instituted and the insurance companies have instituted as well. And I believe it's catching a lot of people off guard, if you will, because of that. And so I just like to jump on, and what's going on is I've got a special Zoom room set coming up here in less than 2 hours. And you can see on the Zoom, I'm able to share things privately with you. I put up the website myhouseofhealthcare.com/office, and I want to throw that over here in the chat as well. You can click this, and then for 11 o'clock, myhouseofhealthcare.com/office, go over into the chat. You'll see that over there. But there's some interesting things going on. One of the things that's going on is Medicare Advantage plans. I saw this back in 2012, 11 and 12 here locally, where there were some companies that had Medicare Advantage plans that had come in and then had given a year or two and they left. I'm telling you something, folks, this does present a great opportunity for you if you have had a Medicare Advantage plan and you maybe have a health situation. There's a little loophole there that allows you to grab a hold of a solid plan, allows you to go to any doctor anywhere in the U.S. that's taking Medicare, even though these plans may typically require underwriting to get into. But the fact is since you are on Medicare Advantage, there is that ability to jump over there. So I helped a lot of people, 12 years ago doing this. Now we're seeing it again in some areas. So you're welcome to jump on that site that I have up there. And you can either jump into the private office hour coming up here on Zoom at 11 o'clock and ask me privately on these things, or you can jump over there on that same page, myhouseofhealthcare.com, myhouseofhealthcare, and you can myhouseofhealthcare.com and set up a 30-minute appointment. So I do have appointments that are being able to be scheduled over there as well. Okay. So that's that. And if you say, hey, Mark, I don't know how to use Zoom or anything like that, hey, no problem. You can call in phone. The phone number's up on the screen as well. And you can still, if you're not watching this right now, you can still take down the number. You can see the ID number on there, and there's a passcode. So all that, I'm sitting there behind the scenes. It is a private situation where people are able to come in and talk to me personally, one-on-one as well. Before I let you go, I would also say this too. If you have original Medicare, that's Medicare A and B, now's the time to look at it as well. A and B. I'm telling you, there's a lot of discussion as to what kind of out-of-pocket expenses you would have if you only have Medicare A and B and you do not have a Medigap or whatever plan to plug those holes. You may have services denied because of the fact that healthcare providers don't want to be hang out with that 20% bill that you're responsible for. They don't want to be on the hook for that. So be very careful if you have original Medicare only. Now's the time to look. Or if your Medicare Advantage plan is leaving, now's the time to look as well. Okay? All right. Well, I'll see you guys over at on the Zoom, myhouseofhealthcare.com/office. And you'll see the Zoom information there, and there's a phone number that's available there. You can jump in, talk to me directly when you go in there. All right. So with that, I look forward to seeing you over there. It's always good to see everybody, and we'll catch you live. We only have until December 7th, right? So it's a little bit of time. So opening up the hours right now to help people as they come in. We'll talk to you soon, and may your savings account be safe